Good afternoon, everyone. Bon après-midi. Au cours des 2 dernières semaines, nous avons pu constater les répercussions nocives qui peuvent avoir des préjugés et la discrimination dans notre société. Nous avons vu des millions de personnes prendre une position héroïque pour la compréhension, la compassion et l'amour. Les préjugés peuvent cependant se manifester sous diverses formes. Ils ne s'appliquent pas seulement à la couleur de la peau de quelqu'un, à sa croyance religieuse ou à l'origine de ses ancêtres. En ces temps de pandémie de COVID-19, nous constatons également des préjugés qui sont fondés sur la présomption d'un état de santé. Ces préjugés sont alimentés par la peur et l'incompréhension, tout comme d'autres formes semblables de jugement discrétionnaire. Cette situation se produit présentement dans notre province et elle doit cesser. Over the last 2 weeks, we have all seen the corrosive effects of discrimination, racism, and all the effects that it can have on our society. We have witnessed millions of people taking a heroic stand for understanding, compassion, and love. But discrimination takes many forms. It isn't only about the color of someone's skin or their form of worship or where their ancestors came from. In the COVID-19 pandemic, we are also seeing discrimination based on presumed health status, and this is grounded in fear and misunderstanding, like all such judgmental responses. And it is happening in our province today, and it has to stop. We know that there are many social determinants of health, les déterminants sociaux de la santé et inégalités en santé, that prior to the pandemic were having negative impacts on people's health outcomes, where people live, how they work, including discrimination and race, vulnerable populations, et cetera. COVID-19 exacerbates those vulnerabilities, and so we know that people who are at higher risk for COVID-19 outcomes that are poor are people that were already disadvantaged. So we already have things that we know that we need to address with respect to how we go forward with our COVID-19 response. The outbreak in Zone 5 continues. Today, there are 4 new cases of COVID-19 to report in that region as follows. 2 individuals aged 50 to 59 and 2 individuals aged 80 to 89. And these new cases are currently under investigation, and there are now 29 active cases in Zone 5. And we are continuing to work hard to limit the spread of this virus. And when I say we, I mean the people at the adult residential facility, La Manoir de la Vallée. I mean the EM, A, and B staff. I mean public health staff, Vitalité and Horizon staff, all working, and social development, all working super hard to contain the spread of this virus at the moment. L'éclosion se poursuit dans la zone 5. J'annonce qu'il y a 4 nouveaux cas de COVID-19 à signaler au Nouveau-Brunswick aujourd'hui. Ils se répartissent comme suit. 2 personnes âgées entre 50 et 59 ans, 2 personnes âgées entre 80 et 89 ans. Ces nouveaux cas font présentement l'objet d'une enquête. Il y a présentement 29 cas actifs dans la zone 5 et nous continuons à travailler d'arrache-pied pour restreindre la propagation du virus. Et je voulais remercier tout le staff à la Manoir de la Vallée, les gens qui travaillent pour le développement social, Vitalité, Horizon, Extramural et la santé publique. Today, the people of Campbellton, Restigouche region need us to be there for them because we could be that next community that is impacted by COVID-19. So I want us all to think about how would we want to be treated if we were in the same situation. Because I am aware of social media posts, I'm aware of emails and different exchanges of information around fear around people coming to and from that region. So again, originally when we went to Zone Orange in that area, it was really about containment and it was about making sure we had all the contacts traced. All that work has been done. So all the people that are at risk are self-isolating at home right now. I want to thank the people from Campbellton and Restigouche for their patience and their attentiveness. And I also want to thank our partner organizations from around New Brunswick who have come to their aid in recent days. The people of Zone 5 don't need judgmental or fearful looks or actions. They need our compassion and they need our support. Just like we would want compassion and support if there's an outbreak of COVID-19 in our community. Je tiens à les remercier pour leur patience et leur vigilance, et je tiens également à remercier tous nos organismes partenaires de l'ensemble de la province qui leur sont venus en aide au cours des derniers jours. I did hear somebody say that originally they heard messages from myself and the Premier saying we're all in this together. But I know for a fact that there are people in Zone 5 who don't feel that that's true right now. They don't feel like we're all in this together. And I would really like for everyone to think about that, and I would really like to think about their actions and their words on how to make people from Zone 5 feel like we are all in this together, because we are. They don't need to be ostracized for their place of residence, and they don't need our fear, and they don't need our anger. They need compassion and support, and I hope everyone will provide it. On Tuesday, there was a case of COVID-19 reported in Zone 1, which is the Moncton region. And I want to provide some further details on that case because it shows how our protocols to prevent the spread of COVID-19 are working. And again, let's remind everyone that the goal was never to have 0 cases. The goal was to always be able to contact trace, isolate, and test and prevent further spread and further outbreaks and further transmission, and not overwhelm our healthcare system. So this individual in question is a temporary foreign worker, and upon arrival in Nouveau-Brunswick, as all temporary foreign workers are required to do, is to be in self-isolation for 14 days. And this, the issue around temporary foreign workers is not new with respect to their work that they do in every province across Canada. And in terms of the risk for COVID-19 with foreign workers, temporary foreign workers, we had some lessons learned very early on, several months ago, when there was an outbreak in British Columbia in a group of temporary foreign workers. So the lessons that we learned from that situation, we were able to incorporate into Public Health Agency of Canada guidance and also our New Brunswick Public Health guidance on temporary foreign workers. So that's why the self-isolation piece is so important, so that we are minimizing that risk. Again, the risk can never be 0 because this is a global pandemic, and we know there will be cases in other countries and other provinces for quite a while. So keeping all of that in mind, the processes that we have in place in terms of the public health protocols, again, the temporary foreign worker in this case was in self-isolation, and we had planned, again, according to our public health protocols, to test the group of individuals, all the temporary foreign workers, after 10 days of the self-isolation. And so all of the temporary foreign workers have been tested, and that person who tested positive will remain in isolation. But again, because we go above and beyond as often as we can, because that's who we are further consulting with infectious disease specialists as well as our regional medical officer of health for any further actions at this time. And we will keep you posted on any new developments as they arise. So we provided very clear guidance to businesses who wish to bring temporary foreign workers, and strict protocols were put in place to protect these workers and all New Brunswickers. Employers are required to have a COVID-19 operational plan, which assures arriving workers have appropriate accommodations before and after self-isolation, access to health insurance, proper food and supplies, as well as cleaning and disinfection for their workplaces. Nous avons un cas confirmé, mais la personne en question a eu très peu de contact avec les autres depuis son arrivée au Nouveau-Brunswick. Nous sommes donc confiants que ce cas peut être isolé, mais comme je vous dis, l'investigation continue. On vérifie avec le médecin hygiéniste en chef de la région et aussi avec les spécialistes de maladies infectieuses. Et on continuera l'investigation, et s'il y a d'autres informations on va vous parvenir d'autres informations. Le personnel de la santé publique continuera de surveiller cette personne et les autres membres du groupe et mènera une intervention si d'autres cas surviennent. These workers are part of our economy. They all deserve to be treated with dignity and respect. And again, across the country, there are numerous industries that require temporary foreign workers to do work here. And again, all of the protective actions from a public health perspective are similar across the country, again, for the reasons of protecting the workers and also protecting the public. We must support these workers in achieving what we all want and need: living wages, labor market supports, employment benefits, secure jobs, occupational health and safety, as well as healthy housing, nutritious foods, access to healthcare, transportation, and social supports. La COVID-19 a transformé l'économie mondiale. Elle nous donne l'occasion de restructurer notre société pour permettre à tous d'avoir accès aux mêmes mécanismes de soutien et de protection. Nous sommes tous confrontés à la même situation. Nous devons travailler ensemble et nous soutenir mutuellement afin de réussir à traverser cette pandémie. Each case brings the same public health approach. As I've said many times, we isolate, contact trace, and test, and each individual who is a close contact of a case will be contacted by public health. If there is a workplace exposure, public health will contact the workplace, and if there's a public exposure, we will notify you in either a press conference or a press release. So please respect this process, because we have to respect our fellow New Brunswickers, but public health needs everyone's cooperation to succeed. So I am asking everyone to be kind and to show compassion and provide support to their fellow New Brunswickers. And there's a Buddhist philosopher, and I can't pronounce his name, I'll try though, Thich Nhat Hanh, reminds us of the power of kindness in healing the pain that life can bring. The source of love is deep in us, and we can help others realize a lot of happiness. One word, one action, one thought can reduce another person's suffering and bring that person joy. Today, help someone achieve joy in their life. Be a beacon of hope and caring to others, because that is what we all need right now. Thank you very much.
Bonjour, good afternoon. As Dr. Russell has shared today, we have 4 new cases of COVID-19 in Zone 5, the Campbellton-Restigouche region. Ces nouveaux cas nous rappellent qu'il est important de rester vigilant et de respecter les directives de la santé publique. Les règles sont en place pour nous aider à minimiser les risques pour notre population. As we have seen with what is happening in the Campbellton-Restigouche region, as well as the new active case in Moncton area, that was announced yesterday, we are still vulnerable to the virus. This is true of all regions of our province. In the Campbellton-Restigouche region, the cases are largely contained to the special care home and are all connected. We have been closely monitoring and testing staff and residents at Manoir de la Vallée, and the residents in the affected wing have been isolated. The necessary steps are being taken to protect everyone impacted as much as possible. Although the person who tested positive yesterday is a temporary foreign worker, we have the proper procedures in place. These workers self-isolate upon arrival in the province. They are tested as part of the process. This enables us to contain the spread of the virus. Ces cas démontrent que le système que nous avons mis en place fonctionne. Cela montre également qu'il est important de suivre les règles et de s'auto-isoler quand il vous ordonne de le faire. We have safeguards in place, and we are ensuring that our borders remain controlled, but they are not closed. Essential goods and services are still getting through. They must get through. Je comprends que vous soyez préoccupés par la santé et la sécurité de vos amis, de votre famille et des autres résidents de Nouveau-Brunswick. C'est une bonne chose. Cependant, ce n'est pas le moment de montrer d'un doigt les gens qui habitent dans la zone où il y a des cas. As we navigate our way through this extraordinary time, we need to take care of one another and do all we can to keep ourselves and each other healthy and safe. If we can do that, New Brunswick will emerge from this stronger than ever. Thank you. Merci.
Thank you, Premier. Thank you, Dr. Russell. Merci, Monsieur le Premier Ministre et Dr. Russell. We'll now proceed with questions from the media. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Elizabeth Fraser, CBC.
Residing at the long-term care facility in Atholville.
Hi there. Yes, there were 2 patients and 2 staff.
Thank you, Ms. Fraser. Do you have a follow-up today?
Yes, I do. Where does this question is for Premier Higgs. Where do things stand with the Atlantic bubble, and why aren't we doing anything about that now?
So we are still having discussions on that. In fact, I have a meeting tonight with the other three premiers of the Atlantic region. It is still very much on the radar to look at this in early summer. We haven't set a date collectively. I think, in the situation now, it's also what we have here in Nouveau-Brunswick and the conditions in the north, which we believe are well contained, as Dr. Russell states, and that we want to be sure that, we have, let's say, stability here in our province, because I'm sure that will be a concern for PEI and with Nova Scotia as well, or Newfoundland. So that is still on the radar. It's something that I would envision that could happen early summer. And we will collectively talk about each other's situations, our alignment with protocols that are required in our provinces. And my intent is that we would collectively make a decision public in the coming weeks.
Thank you, Ms. Fraser. Thank you, Premier. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, given the reduction in services at hospitals, can or do the health authorities prioritize reallocating physicians from within the province to work in areas of need rather than bringing in doctors from other provinces?
So I guess with respect to COVID-19, early on in the pandemic, when we were in the red phase, we did actually reduce services all around the province to make sure that we had enough hospital beds, ICU beds, et cetera, for patients potentially if there were a big surge in a need for those types of patients. And what we learned from that exercise is that we do have some flexibility in the system in terms of reacting quickly in a situation that requires us to move in that direction. But prior to the pandemic, we did have healthcare worker resource issues. Those are long-standing. So in a pandemic situation, sometimes that can be highlighted and exacerbated, but the regional health authorities do manage their healthcare worker situation. And at the Department of Health level, we certainly do try to help with whatever types of input that we can help with. But again, at the provincial level, prior to the pandemic, we had healthcare workers, whether it was physicians or nurses, and recruiting issues around that. And certainly in a pandemic, that can also be an issue. So again, the regional health authorities do address those issues at the regional health authority level.
Thank you, Doctor. Ms. Hogarth, do you have a follow-up?
I do. It's just a quick follow-up. It's for Dr. Russell. I know that the Campbellton area outbreak has been linked to one medical worker, but is it possible that it could have come from somewhere else? I know that there's been a lot of blame placed on one individual, but could there be a shadow of a doubt?
Well, all I can say at this point in time is the cases in the Campbellton-Restigouche area, in terms of being diagnosed and having the contacts traced, all of that work has been done. All of the cases with respect to them being linked to travel, again, as opposed to community transmission, because community transmission is when we can't find a link to travel. So all I can say at this time is that the work that needs to be done is being done, and there are a lot of people working very, very hard and very diligently right now to look after the people in the Manoir-de-Vallée, and again, minimize the effects of the outbreak in that facility right now.
Thank you, Ms. Hogarth. Thank you, Dr. Russell. Nicolas Steinbach, Radio-Canada. Nicolas Steinbach. Callum Smith, Global TV.
Hi there. My question is for the Premier. Premier, you said that the borders are not closed but remain controlled for essential travel. What's the latest in the situation with the Campbellton-Restigouche region in terms of residents from Pointe-à-la-Croix, Listigouche residents coming across the border for essential travel? I've heard stories of many people being turned away and then perhaps changing day by day. Can you give us the latest there?
Nothing has changed in terms of the directives from either myself or from Public Health in relation to our border protection. That has been consistent. I think there, what you may be referencing are some of the, let's say, anecdotal situations that we've heard that there were inconsistencies in some of the measures. So I think bringing clarity to that, understanding, who is traveling and for what reasons. I think we were getting various stories of someone coming and what that essential service might look like. So there's been clarity around that. There's also been clarity to repeat customers that were moving in and out. But still, the requirement is clear. It is for essential service only across the border. And those essential services are defined in the region and is defined throughout our borders elsewhere. So there have been no change to our protocol between Quebec and New Brunswick.
Thank you, Premier. Mr. Smith, do you have a follow-up?
I do for Dr. Russell. Dr. Russell, with the 2 new cases today, are these still in the same one wing at the Manor in Atholville? And can you confirm the number of people in that wing versus the number of active cases?
I don't think I have all the details, but my understanding is that some of the cases are outside of that wing, but I don't have all the details around that, but I can confirm that they're not all on that original wing.
Thank you, Doctor.
Can I come back? Was it Elizabeth Fraser who asked the last question around the travel related? Was that Elizabeth Fraser? Or Vicky? Vicky? Is she still on the line? Because I just wanted to address that again. Is she there?
Ms. Hogarth, are you online?
Well, anyway, just to come back to travel-related cases in a general sense, throughout the pandemic, we will continue to see cases related to travel in this province. And my speech highlighted the fact that I don't want to hear that there is stigmatism. I don't want to hear that there is fear and judgment around a person who has COVID-19 and travels into this province, and if there are cases related to that in the future. I think this will keep happening, and I think we really have to have compassion each and every time, and I would like people to protect people's confidentiality and privacy in these situations, again, because I do feel it will continue to happen throughout this entire pandemic.
Thank you, Dr. Russell. Thank you, Mr. Smith. Nicolas Steinbach, Radio-Canada.
Oui, bonjour. Merci, Bruce. La question est pour Dr. Russell en français, et si M. Higgs veut répondre en anglais aussi, il peut le faire. La question est concernant, je veux savoir si l'éclosion du restigouche dans la zone 5, est-ce que vous le reliez toujours à un seul individu de départ, le patient zéro, à ce personnel de la santé qui ne s'est pas isolé? Est-ce que vous reliez toujours l'éclosion à cette personne-là?
Je suis demandé cette question plusieurs fois, et ce que je veux dire, c'est que durant la pandémie, on va avoir plusieurs cas reliés au voyage. Ça va continuer. Et chaque fois qu'on a un cas lié au voyage et une éclosion, peut-être le résultat d'un cas lié au voyage, je voudrais que les gens soient gentils. Je veux que les gens protègent la confidentialité et l'identité des gens. Je veux que les gens démontrent la compassion chaque fois que ça arrive. Parce que peut-être ça va être quelqu'un qui va être touché par ceci, c'est un cousin ou un relatif ou une sœur ou une mère ou un frère. On est tous ensemble dans cette province en notre approche. Et on devrait vraiment ressentir chacun entre nous qu'on aura le support de la province en entier quand un cas arrive. Et si c'est nous qui est le cas ou quelqu'un de notre famille ou un ami, on veut qu'on soit tous supportés dans le COVID-19.
M. Steinbach, as-tu un suivi?
Oui, merci. C'était pas ça ma question, malheureusement, mais je suis, peut-être que M. Higgs peut répondre. M. Higgs avait qualifié à l'époque, avait dit c'est irresponsable d'agir de la sorte. Il avait utilisé ce mot irresponsable. Est-ce qu'il peut nous rappeler pourquoi est-ce qu'il avait qualifié cette personne d'irresponsable à l'époque du début de l'éclosion dans le Restigouche?
I think we've asked throughout this entire pandemic that everyone, all of us included, no matter what profession we're in, have to respect the rights of others. We have to respect the role that all of us play in protecting ourselves and protecting others from the spread of the virus. There's been numerous ways certainly identified as we best can do that, whether it be the social distancing, the washing of hands, the wearing of masks. So in any situation that anybody puts themselves in that relate to exposing themselves or someone else, it poses an added risk. So I think we all have a cross to bear in that sense, and we all have a reason to be more cautious around whoever we associate with. And so we learn from cases throughout the province. We've learned from this case. We've learned from other cases, and we'll get better at how we respond. And I think, a lot of investigation has been done here. I know in the case of Vitality, they certainly dealt with the situation at hand. And we'll just continue getting better through this because we must open up our economy and move on and learn to live in this new world.
Thank you, Premier. Merci, Mr. Steinbeck. Savannah Ott, Telegraph-Journal.
Hi there. Premier, do you have any regrets about reversing course on your initial temporary foreign worker ban? And do you think the preventative measures worked as intended in this case, such as the isolation and the testing? Thank you.
I think that through this process, we've had to make decisions that were, as best we could do at the time of the need. In New Brunswick, we have tried and reacted very quickly in order to manage the spread of virus in the province. And to date, we've been very successful, notwithstanding the current situation we have in the Campbellton region. As we open up our economy, as we open up our province, we're going to continue to have more risks. It was clear in relation to the requirement for temporary foreign workers that the industries that were impacted, to allow them to come up to full speed, the labor force was not available in order to make that happen. So we have said our economy needs to get moving. People need to be back in the workplace. We need to have a way to restore our society. And so the decision that I made at that time as far as restoring the foreign worker policy, it was reflective of what had been put in place by public health to ensure that we could indeed protect citizens and protect the industries needing these foreign workers as well. In this situation, what's been identified through the testing process is someone who does need to continue isolation, who has been tested positive, and now further testing will be done with all those that were involved in coming into the province at the same time with this group. So we need to make sure, as we have with every other incident, that the contact tracing is done. Any individuals that were connected at the time will be again tested and isolated. So we mitigate the risk as best we can, and we move forward. But moving forward, we will continue.
Thank you, Premier. Ms. Ott, do you have a follow-up today?
Yes, I do. Thank you, Bruce. Second one for Dr. Russell. I know you mentioned the Moncton case remains under investigation. I'm just wondering if we have an initial idea of whether this person was living in shared quarters or, close space with others, and if it's clear yet whether this person contracted the virus here in New Brunswick or maybe in transit while in other provinces while coming here or in their home country.
So what I can say is that each and every case of COVID-19 is approached exactly the same way from a public health perspective. Each close contact is contacted by public health, and those people are tested and isolated. So there is no difference in our approach with this particular situation from the perspective of the public health approach. So at this point in time, the staff in that region, the Regional Medical Officer of Health, Dr. Legere, is conducting all of the investigation and contact tracing at this moment in time, and decisions are being made about what further actions to take.
Thank you, Doctor. Thank you, Ms. Ott. Michel Corriveau, Radio-Canada.
Merci, Bruce. Une question pour Dr. Russell. Les 4 cas, on parle bien de 2 résidents et de 2 travailleurs du foyer de soins Le Manoir de la Vallée. Est-ce qu'ils travaillaient tous et ils vivaient dans la même aile de l'établissement? J'aimerais que vous nous prêtiez peut-être un portrait de ce qui se passe en ce moment dans le foyer.
L'information que j'ai maintenant, c'est qu'il y a au moins un cas qui est en hors de le premier endroit où les premiers cas sont isolés ensemble, mais chaque personne dans la résidence est isolée dans leur propre chambre à ce moment-ci. Et toutes les procédures nécessaires pour continuer à les soigner et les employés de extramural, ambulance Nouveau-Brunswick, la santé publique, Horizon, Vitalité, développement social et aussi les travailleurs de l'équipe originale de la vallée de la Manoire. Ils travaillent tous ensemble pour faire certain que tous les gens sont soignés comme il faut et isolés comme il faut et ils portent les habits protectifs chacun. Alors, c'est vraiment un travail d'équipe à ce moment-ci. Et il y avait des rapports qu'il y en avait des employés qui ont quitté. C'est pas vrai. Il y en a qui sont isolés à la maison, mais le plan, c'est qu'ils vont tous retourner à ce moment-ci. Ça, c'est l'information que j'ai reçue. Mais encore, j'encourage les gens qui ont voyagé là pour aider, travailler dans cette résidence. Maintenant, c'est vraiment incroyable le travail qui a été fait là. Puis oui, alors les employés vont retourner sous peu bientôt.
Merci, docteur. Monsieur Corriveau, as-tu un suivi?
Oui, merci, Bruce. C'est pour une précision, Dr. Russell, vous avez dit qu'il y a une personne à l'extérieur de l'aile où il y avait des personnes malades. Est-ce que c'est une personne à l'extérieur de l'aile ou une personne à l'extérieur du manoir?
À l'extérieur de l'aile, c'est à l'intérieur du manoir.
Et c'est un patient ou une patiente ou une personne qui travaille?
À ce moment-ci, je ne sais pas. Je sais qu'il y a un cas qui est en hors dans l'autre partie du manoir. Je ne sais pas si c'est un staff ou un patient.
Merci, M. Corriveau. Merci, Dr. Laura Brown, CTV.
Hi there. I'm wondering how many civil servants so far have, I guess, answered the call, so to say, help with the situation up north.
Hi, Laura. I don't have the information on how many people have responded. Oh, actually, I do. Sorry. Bruce is giving me the answer, Laura. It's 8.
Do you have a follow-up, Ms. Brown?
You know my tricks now, Laura.
I do. I'm wondering, I know that you had mentioned earlier that the situation has gone beyond the ward that it was initially, the virus was initially found. Obviously, we're learning with this situation that the virus is really brutal, no matter how many measures we really put in place. However, is there more that can be done or that is being planned for this special care home to help with the situation and to keep the virus from spreading further?
Yes, I have a very long answer for you. So originally, when the pandemic started and we did our planning, and again, lessons learned from other jurisdictions, guidance from Public Health Agency of Canada, as well as our own provincial guidance, we worked really hard with the knowledge that vulnerable populations, such as people in institutional settings, including nursing homes, obviously needed to have extra steps and measures put in place to protect them. So at the beginning of when we first had our first case here and we had our border measures put in place, that's obviously one way to prevent the virus from spreading. Number 2 is we closed visitation practices in all of the facilities. And number 3, the recommendation for staff to not move between facilities was given. There are logistical issues around human resources for that to be implemented across the board, but certainly in cases where it was feasible and was possible, it was done. And where it wasn't, it was a requirement in our guidance that any residential facility like a nursing home, adult residential facility, long-term care facility would be required to no longer have staff move from facility to facility if there was an outbreak. So once that happened in Zone 5 in the Manoir de la Vallée, that is what happened, that the people who worked in one facility would not be allowed to move to other facilities, obviously to avoid transmitting from facility to facility. So with that knowledge and the understanding that PPE would be required for these facilities, knowledge of how to use it properly would be required, working with EMP right now around the need for oxygen for patients, et cetera. All of that work is being done at the local level right now. And again, as the Premier said, with every case we learn. And so what we have learned from this situation is, and actually there was another situation where we had a testing group, kind of a SWAT team, go in and test a couple of different facilities actually throughout the pandemic. And also we've had tabletop exercises, we have mock exercises to really test the system in terms of what was possible in terms of a response in these facilities. And obviously preventing a case from getting into a facility in the first place was our primary concern, because once it does get into a facility, it is difficult to mitigate. So you are right, it is challenging. But I think what, again, learning from other jurisdictions is that having staff be able to stay on site and respond and provide the basic needs of patients is paramount, because we have heard in other jurisdictions where people did not do well because of the lack of staffing. So we were able to make sure that we put in place very early on not respite staffing, but replacement staff to address those issues. And at the same time, with public health, really communicate well with our partners. And again, Extramural has been phenomenal at really coordinating some of this effort at this time, so that for future issues around facilities such as this, we now have rapid response teams that are going to be dedicated to each region, so that if we do see an outbreak in a nursing home moving forward, that we would have very quick response. I would say similar to this, only quicker. So again, these are the learnings. It's that we get better, then we get faster. So that's what's happening moving forward.
Thank you, Doctor. Thank you, Ms. Brown. Adil Ibrahim, CBC.
Thank you. It's a question for Dr. Russell. Businesses are adding the question, have you been to Campbellton, as one of their questions before allowing people to enter their establishments. Is this being done on the advice of public health, and is it necessary?
Oh, I'm sorry. I didn't catch the beginning of your question. Can you repeat it, please?
Yeah, no problem. Businesses are adding the question, have you been to Campbellton or surrounding areas, as one of the questions before allowing people to enter their establishments. Is this being done on the advice of public health, and is it necessary?
This would not be on the advice of public health. And again, it goes to the issue that I was speaking to earlier around support and encouragement and not judging and not stigmatizing people who are from that zone. We are going to see outbreaks around this province repeatedly. I can't tell you where the next outbreak is going to be in terms of what community, but I can tell you that we really have to show compassion and support to all communities who experience outbreaks and their residents. So as much as we have a fear of people traveling to and from an area where there's an outbreak, when there is an outbreak, public health contacts each individual close contact immediately. They get tested and they self-isolate for 14 days. So it isn't necessary for people to put up signs and ask questions about if you've traveled to and from an area that has an outbreak. For the healthcare system, there are requirements around extra PPE, and we did have conversations with the task force about some of those issues. But again, those are known people traveling for purposes of appointments, medical appointments, and decisions early on were made about what the risks were and whether or not they should be isolated. But those were at the medical level in a medical setting, in a clinical setting, in a hospital. But in terms of businesses, I do not suggest that that is a recommendation at all. And in fact, I think it's damaging in terms of the people coming from those regions that feel ostracized and stigmatized. The phase orange went into effect 2 weeks ago. That is now, we've come through that first 14-day period in terms of looking at what other cases have developed since then. We certainly have continued testing in that area, and I think there's really only been one other case in the last week outside of the Manoir de Vallée. So that tells us that in terms of the contact tracing and the isolation, all of that has worked. Do I think people still need to have fear about COVID-19? Everybody in the province should be aware that COVID-19 can come into the province at any time from any area outside the province. And so I don't think people should just single out Zone 5 residents in terms of being aware and being cautious and being attentive. So I think it needs to be actions that we take on across the board. And as I've said early on, everybody needs to act as if they have COVID-19 in terms of not wanting to spread it to other people. So you yourself, every single individual in this province needs to act as if they already have COVID-19 and they don't want to give it to somebody else. And so that's why we all have to continue to wash our hands. We all have to continue to maintain 6 feet of social distancing, wear your mask when you're out in public and you can't socially distance. And obviously, lower risk activities are the ones that take place outside when you have ample space to socially distance. And the fewer gatherings you have inside your home with the fewest number of people, again, that is how we minimize the risks.
Thank you, Ms. Ibrahim. Do you have a follow-up?
Yes, thank you. Emily Guillarcino says that Zone 5 residents are being discriminated against not only by businesses in their other regions, but also by healthcare facilities. So are residents of Campbellton being treated differently in the healthcare system? If so, how and what are you doing to prevent that?
Well, again, I have been in touch with some of the healthcare authority staff recently about some of those questions, and we will be addressing that at the task force tomorrow. But certainly from a clinical perspective, there were directions early on about whether or not patients who had already been transferred from the Campbellton Hospital to other facilities, whether or not they needed isolation. So those details were all worked out. But since then, I wouldn't want to hear that there has been discrimination. But again, it is concerning, and definitely we'll be talking about what we can do to mitigate that at this point in time. Because again, we are going to see outbreaks from around the province popping up, and this is the new reality. So we do want to make sure that people are treated with compassion and that they have expectations around what to see. So if somebody is surprised by how they're treated, then again, we can help by informing and giving people expectations. So for instance, in all healthcare facilities now, you have to wear a mask when you enter, and this is the expectation. So the expectation is also that you will socially distance or physically distance. These are the expectations. But in a situation where there's an outbreak in an area, if there are other measures that are going to be put in place, then again, the patients should have the expectation before they arrive so they know what to expect. Because again, if you're feeling judged, if you're feeling discriminated against, that does have a psychological, a negative impact on your mental health and well-being, and it can be traumatizing. So we do want to avoid that. So I will be discussing that with the Pandemic Task Force tomorrow.
Thank you, Doctor. Thank you, Ms. Ibrahim.
Thank you.
Alexandre Boudreau, l'Acadie Nouvelle.
Bonjour, ma question est pour le Premier ministre Higgs. Dites-moi quand il est prêt à écouter ma question.
Vas-y.
D'accord, merci. Votre ministre des Affaires autochtones dit que le racisme systémique contre les Autochtones existe au Nouveau-Brunswick. Et puis, il est d'accord avec l'idée d'une enquête sur le racisme systémique dans le système de justice et dans la police. Je voulais savoir si vous pensez que le racisme systémique existe au Nouveau-Brunswick.
I think it's very important that we understand certainly what happened in this incident in Edmonton, and we are having the full investigation done in that regard. I equally think it's very important to understand kind of across the board how we can deal with any forms of racism that exist in today's society. Do we have a problem in New Brunswick? Likely. I guess we need to understand the issues. I know in the report that was put out on missing Indigenous women a year ago, roughly, it's what actions have been taken. You know, I think it's extremely important that we put all of the facts on the table. We understand very clearly how we can start addressing issues that either lead to discrimination or bias or promote discrimination or bias in any way, shape, or form, because it is absolutely unacceptable in today's society. So let's understand, and I know a lot of reports and studies have been done. Have we acted on them? Have we actually moved the bar and said, let's deal with issues? Right now, I'm very concerned with the issue that was happened just recently and right here in our province, a most unfortunate incident that was it unnecessary? We'll know the details, but certainly it must have been preventable in some way, and we need to find out the details around that. I'm focused on learning that, and then we go from there.
Merci, Monsieur le Premier ministre. Monsieur Boudreau, as-tu un suivi?
J'ai une deuxième question pour la Dr Russell. Je voulais savoir, Dr Russell, s'il y a une bulle avec d'autres provinces de l'Atlantique cet été, quels sont les défis logistiques d'une perspective de santé publique à régler avant qu'on puisse penser à ça? Est-ce qu'il y a d'autres mesures de santé publique qui doivent être mises en place pour qu'on puisse avoir une bulle avec les autres provinces cet été?
Alors, j'ai discuté avec les médecins hygiénistes en chef dans l'île du Prince-Édouard et aussi Nouvelle-Écosse. Et alors, nos recommandations au sujet de santé publique vont être communiquées avec notre premier ministre. Et c'est les premiers ministres qui vont avoir une réunion pour discuter des détails sur la possibilité d'une bulle, puis les dates, puis les détails vont être discutés avec les premiers ministres.
Merci, Doctor. Merci, Monsieur Boudreau. Colin McPhail, CBC.
Hi there. My question is for the Premier. CBC has been receiving calls from essential workers receiving conflicting information about self-isolation. So if an essential worker is working outside New Brunswick in, say, a neighboring province like Nova Scotia, do they have to self-isolate for 14 days?
Upon returning to the province. It might be a situation like we have here, essential workers coming into the province. You know, WorkSafe is working with these, whether there be contractors, there be people that are coming here for business reasons. They have been given protocols around how they manage their work here. I know that's happening with different businesses, people coming in. Nova Scotia may have a similar situation. We do have businesses moving across the province under very close guidelines, under very close rules, so they can contain themselves and operate their business. And other essential workers that move, I know in the healthcare field, there's other essential workers that are moving, but they put all of the protective equipment in place. They wear everything they need to wear. And in some cases, the isolation process is not possible in terms of the 14 days. Dr. Russell may want to add to that.
So there are a couple of situations around essential workers, healthcare workers in particular. For instance, if they work on one side of the border and they live on the other side of the border, they are allowed to go back and forth without self-isolating on a daily basis. And that is an understanding with the maritime provinces at this moment in time. And with respect to work isolation, whether it's a healthcare worker or a non-healthcare worker, WorkSafe New Brunswick works with the organizations, the employers, to make sure that there is a plan around work isolation. But those details are worked out through WorkSafe New Brunswick, and they usually have to have like a 15 days prior to the work isolation plan. And in certain situations, there is testing that is done as well. So those details, again, are worked out with the individual employers and WorkSafe New Brunswick.
Thank you, Premier. Thank you, Doctor. Mr. McPhail, do you have a follow-up today?
I do, thank you. This one is for Dr. Russell. The New Brunswick government is asking public servants to volunteer to fill staffing gaps at the Manuel de Vallée without any previous healthcare training required. So if no previous training is required, why don't you ask for volunteers beyond the civil service to help out volunteers like family members?
That's a great question. I will take that back to the staff that are working on this.
Thank you, Mr. McPhail. Thank you, Doctor. Jean-François Boisvert, l'Acadie Nouvelle. Jean-François Boisvert, l'Acadie Nouvelle. David Coach, Times and Transcript.
Yes, Premier Higgs, in Edmonton, the family of Chantel Moore has been looking for answers about her death at the hands of police during a wellness check. Your government has said we'll get answers when the investigation is complete, but the Quebec Bureau des Enquêtes Indépendants, the BEI, which is in charge of the investigation, says it might take several months before the investigation is complete and the final report won't be made public. how can the public have confidence in a report that they won't get to see?
Well, firstly, at this point, I believe arrangements have been made to update the family on the progress of the investigation. Now, that doesn't mean all of the details can be provided, as many of the details may be, not available as such for the public. And I guess I can understand it's an independent investigation, and it'll decide where we go from there with the investigation. However, I do believe that it will take likely, several weeks or months. We cannot, we've asked for it to be independent. We've asked for it to be conclusive. And we've said that we will keep the family informed of the progress, and so that they know it is actually being done. Because I think what's very important right now is that the family and ourselves and myself want to have a very clear understanding of what happened, why it happened, and how do we avoid these incidents in the future. And everyone wants to know that. So whether we can disclose or whether I even know all of the details at the end of the day, I want to know what can be done to prevent this sort of situation in the future.
Thank you, Premier. Mr. Coach, do you have a final question or follow-up?
Yes, also for Premier Higgs, there have been calls for police to be defunded with money to be reallocated, for example, to mental health services to address root causes of social problems, often leading to confrontations with police, some of them which turn out deadly. Do you support these calls, and why or why not? And should police be doing wellness checks?
Well, certainly, I guess when I talked a little earlier about understanding all the facts that lead to an extreme situation like we've experienced over the last couple of weeks are extremely important to understand. I think it is premature to say we want to defund the police services. I know that I'm sure throughout the province, throughout our country, we have all had value our police protection. We all value the services that they provide, and the many instances that they find themselves in harm's way to protect the citizens. So it isn't all of a sudden we're going to change policy and move in a new direction. I think we need to understand, why do these incidents occur? How do we prevent them in the future? And what are the roles to mitigate the situations that a police officer find themselves in, and they feel their life is threatened in some way, that they have to act in a way that from the outside looks to be overly aggressive. And certainly when loss of life has occurred, it would seem that absolutely it's overly aggressive. But let's learn the facts. Let's make decisions based on those facts of how we move forward.
Thank you, Premier. Jean-François Boisvert, l'Acadie Nouvelle.
Oui, bonjour Bruce. Désolé, ça a raccroché. Oui, ma question, c'est pour soit le Premier ministre ou Mme Russell. Ça porte sur les enfants en garde partagée dont un parent habite le Nouveau-Brunswick et l'autre dans une province voisine, précisément dans ce cas-ci au Québec, en Gaspésie. J'ai reçu, on m'a rapporté que quelques mères, toutes des travailleuses essentielles à l'hôpital de Campbellton, ne peuvent envoyer leur enfant dans une garderie du Nouveau-Brunswick. Ils ne peuvent le faire qu'après 14 jours suivant leur retour de chez leur père qui habite au Québec. Ces femmes ont donc deux choix, c'est soit ne pas travailler pour garder leur enfant à la maison avec elles, ou ne pas envoyer leur enfant chez leur père de l'autre côté de la frontière, donc contrevenir à la loi. J'aimerais donc savoir si ces deux options sont effectivement les deux seuls choix qui s'offrent à ces travailleuses, ou s'il y a des exemptions possibles pour ces familles.
You know, I think the answer kind of speaks for itself in relation to the risks that it poses crossing borders, and especially if the children are coming from different areas and that maybe are more amply exposed to the virus. But we have a policy about people moving in and out. We also have a federal system that very much recognizes that there will be cases that people are not able to go to work because they don't have the appropriate daycare, or because this is a new day we're in. There needs to be a mechanism to self-isolate, and there needs to be a mechanism to protect the worker too, or the mother or parent, or father in this case, because you have a situation where if the child is coming back to the province, and if the child has a virus which may be completely undetectable until they're tested, then the parent is also a carrier or impacted. So in these situations, there has to be a mechanism in place where isolation rules are followed so that we know that the carrier isn't exposing others once they return. It's kind of a sad state that we're in that regard, but it's a necessary process to make it work.
Monsieur Boisvert, as-tu un suivi cet après-midi?
Oui, toujours sur le même sujet. Considérant la proximité de ces deux régions-là, le Campbellton et la région d'Avignon, et que ces travailleuses-là, justement, peuvent du jour au lendemain ne plus travailler à l'hôpital en raison de leurs conditions, de devoir garder leur enfant et vraiment causer des bris de service. Est-ce qu'il n'y aurait pas de possibilité peut-être d'envisager la création d'une bulle avec une région? Si on l'envisage avec l'île du Prince-Édouard, peut-être l'envisager avec une parcelle de la Gaspésie?
Well, it's certainly possible to do that, and so it's something worthy of discussion. However, we don't have any control within other provincial boundaries. Like we have a control within our provincial boundaries, but we don't have control with regions in other provinces. So people can certainly move around freely in another province, and it isn't anything that we can monitor or have any real exposure or visibility in. So I think it'd be difficult to do that. I think as long as we have the protocol we have in place and it's part of the public health guidelines, then we need to be vigilant about how we make it work. Because we know that, one case can spawn many, and we know we've seen the reaction certainly around us in other provinces. So we can't lose sight of the risk, and we have to be diligent about prevention measures.
Thank you, Premier. Merci beaucoup, Monsieur Boisvert. Cela conclut la séance d'aujourd'hui. Merci beaucoup. That concludes today's update. Thank you very much.